It's now my pleasure to introduce Alisa Almas. Dr. Alisa Almas is a research associate at HELP. Her research focuses on social development across childhood and adolescence, with a special interest in children in at-risk or atypical populations. Alisa is leading the CHECK project at HELP, developing and validating the population level tool, the Childhood Experiences Questionnaire, or CHECK, for assessing the experiences children have prior to kindergarten across multiple domains of development. Over to you, Alisa. Thank you.
Thanks so much, Joanne. I'm so happy to be here this morning with this wonderful group of colleagues, and I wish I could see the faces of all of the friends that are joining us today to be a part of these presentations. Today, I'm going to be talking about the impact of the COVID-19 pandemic on young children and families in particular, and using data from the Childhood Experiences Questionnaire. I'll be highlighting some of the insights we've had into these impacts as the pandemic has continued. As Joanne mentioned, I'm a researcher at the Human Early Learning Partnership, and I'm excited to be highlighting this work that my colleagues and I are so proud to be a part of, because it allows us to gain insight into children as they grow and develop over time. I'm also very grateful, and I respectfully acknowledge that I have the privilege of living and working on the unceded territories of the Musqueam, Squamish, and Tsleil-Waututh nations. And I'm ready to jump in and start sharing with you all some of the information we've gathered from the chat. One of the reasons we focus in particular on young children and families is because we know from decades of research and from the work on the grounds of our colleagues who work with young children that this is a critical time in development where the experiences children have and the opportunities that are provided create the foundation upon which all subsequent development is going to happen. So this critical time is an especially important one to focus our attention during a global pandemic to determine the impacts on children as we move along. We know from some of the research that's already been emerging throughout the pandemic that there are a number of themes or critical areas that people have already identified. One of them, of course, being the inequities that children are facing. So that some of my colleagues today have highlighted that the pandemic is exacerbating these inequities that already existed. We know that the lack of access to childcare and education is having a profound impact, as others have mentioned today. And of course, the lack of or disruptions to access to healthcare and other support services, including mental health services, again, are these key areas that we need to focus on and determine how we can better support young children and families going forward. Just highlighting, of course, as Magdalena mentioned, that early education and related to that childcare provides many opportunities for children that are critical to their development, not only to early academic experiences, but social experiences, physical activity and outdoor play, access to services, food programs, and of course, allowing parents to work. And these disruptions to these have had an enormous impact already on our young children. And as others have mentioned today, of course, we see from Jennifer and her colleagues' reports that there's this expected increase in mental health issues with a ripple effect from the pandemic on access to health services, the closures of these, delays for assessments, therapies and procedures, and the waiting time for access to care may affect children's growth and development in important ways. And so we're especially lucky at HELP to be in the position of having a number of tools that were created to follow and examine experiences in the development of children from toddlerhood all the way through to adolescence as part of HELP's child development monitoring system. And we're fortunate that the system was in place before the pandemic began so that we could use these tools to understand the consequences of the pandemic on children's development. And in particular, today, I'm going to be talking about results from the Childhood Experiences Questionnaire, or the CHEQ, that is a survey completed by parents or caregivers of children when they're typically 5 years old and they start kindergarten. And the questions here are focused specifically on children's early experiences and the contexts in which they live and grow. So in September and October of last year, we were excited to collaborate with 7 school districts across British Columbia and have almost 2,000 parents or caregivers complete the questionnaire, as I said, when their children first started kindergarten. And because the school districts that worked with us this last year have been using the CHEQ for a number of years, it not only allowed us to understand what was happening for children and families last fall, but also we have the chance to look at change over time in these communities. We have the experiences and the rates of experiences that children typically have in these communities, and then we were able to look at what happened during the pandemic and how did this impact the experiences that children were having and the access to services, supports, and care, and what the barriers to these accesses were. I just want to highlight for you very generally the key domains that the CHEQ is focused in that cover a breadth of areas across early child development that research has identified are crucial for that strong foundation, as I mentioned earlier. And the questionnaire was developed in collaboration with early years professionals and educators, as well as parents of young children, in order to determine what key areas within each of these domains were critical for both understanding where gaps were in children's early development, as well as what information would be most useful for our colleagues in the early years sector to strategically support young children and their families before they arrive at kindergarten. And in addition to the questions we typically ask on the CHEQ, this last fall, we were able to add a module or a set of questions asking about specific impacts of the pandemic related to 2 time periods. So we were most interested in that acute phase of the pandemic back in the spring when things first started and a number of the restrictions around physical distancing and closures were put in place. And then also in the fall, we wanted to know how things have been going for families. Have they gotten worse? Have they gotten better? Or have they stayed the same as the pandemic has continued? So what have we learned? I'm going to share kind of excerpts from the data that we have available in a rapid report that we created, summarizing the information we collected from families with young children, and hope that this will provide sort of pique your interest into looking into this area more specifically and focusing on and supporting families with young children. And so first off, a bit of a good news story, as we see that parents and caregivers indicated that for some of them, that they were able to play together as a family more, both at the start of the pandemic, as you can see in blue, and then in pink, as the pandemic continued, even more families indicating that they had more time to play together, likely due to the physical distancing restrictions and the fact that activities and play dates and so many other things that families typically do were no longer possible, and therefore there was more time freed up to spend time together. When we look at reading together, critical experience for young children, we see that a small proportion of families did actually indicate that they were able to do this more, again, potentially having more time to do this. And for the majority of families, this stayed the same. So we were encouraged to see that there wasn't less time for this critical early experience for families. The area that we most expected to see, and of course did see parents reporting, was that their children had less time with peers and with friends, especially as the pandemic continued. 76% of families said that their children had much less time with their peers as the pandemic continued, due, of course, to the restrictions put in place to prevent the spread of the virus. And as I mentioned, our districts had completed the questionnaire in previous years, and in the regular portion, not the COVID module, we saw a similar pattern where in 2009, we saw 85% of families saying that a few times a week or more, children had the opportunity to play with kids other than their own siblings, and this dropped down to 67% in 2020, mirroring those results. So a drastic decrease in those opportunities for being around other kids and developing and practicing social skills and gaining that feedback from peers around what works and what doesn't when interacting with others, to help solidify and strengthen those skills before they arrived at kindergarten. Another area where we see this impact is in participation in organized activities. And you can see that typically, for example, in 2009, 18% of families were saying that their child never participated in organized activities. And in 2020, this shot up to 50% of families saying their children did not have the opportunity to participate in these types of organized weekly activities, where again, they'd be exposed to a regular peer group, exposed to another adult, and learn those skills for interacting with others that help support them when they arrive in formal schooling at the start of kindergarten. When we looked at physical activity, another critical experience in the early years, we were encouraged to see that the majority of parents said that their children were physically active around the same amount as before the pandemic, with a large proportion, a quarter of parents saying that their children were actually more physically active as the pandemic continued. The one downside here is that 17% of parents were actually saying their children were less physically active as the pandemic continued, whether it be because of the restrictions or parents having less time to take their kids outside or less opportunities in or around their neighborhood to be outside in a safe place. That increase as the pandemic continued was a bit worrying. And again, looking at the regular year-on-year data from the check, as I mentioned, similar rates over time of the frequency with which children are playing outdoors for the majority of families responding. When we pair that, of course, with screen time, the picture isn't as positive. We see an enormous jump in families reporting that their children were getting more screen time as the pandemic continued. 18% at the beginning of the pandemic saying that their children were exposed to more screen time, 53% of parents indicating this as the pandemic continued. And we know that's a theme that's been picked up in the literature as well as in the media, as parents are struggling to keep their children entertained while they juggle the challenges of their own work and other responsibilities throughout this pandemic. This slide here reports on access to services and resources, and it's a little bit to unpack, so I've got an arrow to show you the section of the pie chart to pay attention to, and that is, as the pandemic continued, the number of parents reporting that their children were able to continue their use of services or supports, but in a different way, jumped to 42%, so almost half of parents. And you can imagine the stress that this likely has in both the parent and the child as they're receiving their supports or services in a different way and having to adapt to that. But also the individual providing the support has had to adapt their service delivery methods to meet the needs of the family and the child, while also trying to do that, whether it be online or in a physically distanced way. And so the enormous amount of support that comes from, or the amount of stress that comes from that, is not to be diminished. We also had parents reporting on their access to childcare, and we see as the pandemic continues, 47% of parents say had less access to consistent childcare. So as that pandemic continues, we're seeing service and support deliveries changing and becoming different or less. We're seeing access to childcare and consistent childcare becoming less. And when you pair that with parents reporting that, again, as the pandemic continues, increases in their levels of stress, we're not surprised by the findings coming together in this way, highlighting that snowball effect on parents and caregivers as the pandemic continues, as opposed to in that acute phase where many people expected the level of stress of parents and caregivers to be higher. And finally, in this slide, we've asked about increases or decreases in overall household income. And again, you see that the decreased income has gone up as the pandemic continues, adding to that stress. And then here we see time for self-care. Again, in thinking about our caregivers and their reports of an increase from 26% of parents and caregivers saying they had less time for self-care when the pandemic first started, up to 43% as things continued into the fall. That's painting a very challenging picture for our parents and caregivers, which is similar to what Magdalena was highlighting about teachers and them being caregivers too, and the stresses of adults, especially those with children, that Hasina and Evelyn were noting in their presentation. But despite all of those stresses and challenges, the interesting thing here is that we ask questions about how often parents have the opportunity to talk to their child about their emotions or feelings, as well as the emotions or feelings of the caregiver themselves. And despite all of these challenges, as well as the stresses of the ongoing pandemic, we see similar rates between 2019 and 2020 in the frequency with which parents are finding the time to do this. And so they're still able to and motivated to support the emotional development of these young children during this trying time, and even reflect on their own emotions or feelings, which of course helps support the children's emotional development going forward. But the take-home message here is that parents and caregivers, especially in recognizing International Women's Day, and as our colleagues doing research in this area, and as the media has recently shown, are the ones bearing the burden of this pandemic and of the ongoing mental health challenges, physical health challenges, restrictions, impact on work, all while trying to raise healthy and happy young people. And so where do we go from here in thinking about these challenges that our young children and families are facing? Well, we know, of course, that this pandemic has gone on much longer than many of us expected, at least in the beginning, and certainly much longer than we were prepared for, whether it be mentally or physically. And the lasting impact from the stress and challenges is unknown. But we know from the data that I've just shown you, along with much more that we collected using the check, that this data not only provides us with insight into the experiences of families, but is actually put into the hands of educators and early years professionals who are using it to strategically support young children and families in their communities right now. And so we're encouraged by that action taken using the information shared right from the mouths of the parents and caregivers. And our next step, of course, is going to be to collect this data again this fall to continue to gain insight into these experiences with the hope of really understanding the impact of the long-term pandemic restrictions on families, and to follow these children over time using our monitoring system at HELP to gain insight into the lasting impacts on children's development. The hoping, of course, that we'll be able to uncover the mechanisms by which the stories of courage, resilience, and positive change have emerged and can be shared with others to inspire and really support families as best that we can. I thank you for listening to me today, and I don't think there's time for questions. Sally, you can correct me if I'm wrong, but I look forward to sharing during the discussion with Paul.
Thanks so much, Alisa. There's Joanne, yes, and we're going to carry on with what we started before the first dialogue, that if you have questions for Alisa, please put them into the Q&A function, and she will be able to answer what she can during this time and be able to follow up as well. We're excited that we're hoping to collect even in more communities with CHEK come next fall. So it's a project that we're really excited about at HELP. So our last presenter is Liza Haldene. So she's going to share with us a bit of a perspective from the community for the next 10 minutes or so. Liza is a member of our Aboriginal Steering Committee. She lives in the community of Laxgalsap. I hope I got that kind of right, Liza. She's been in the field of early childhood care and education for 12 years. And you will learn very quickly after you listen to Liza that she's extremely passionate about the early years. She believes in connection, equity, and empathy as being key to work for a better tomorrow. So over to you, Liza. Thank you. You need to unmute, Liza. Here we go. We can hear you.
Yay! Well, now that I got that little faux pas out of the way, we can move forward. So I'm a Heathlook. As mentioned, I am coming to you from the beautiful community of Laxgalsap here within the Nisga'a Nation. This presentation is dedicated to all the children and families of BC, in particular the vulnerable Indigenous communities that have lost fluent speakers and elders to the pandemic. So in creating this presentation, I took the time to reflect on our journey here at the Extend Head Start, and the word courage was the most fitting title to capture our experience. Courage, finding our way in a time where there is no longer a clear path. Oh, sorry, I'm not sure. Well, Merriam-Webster defines courage as mental or moral strength to venture, persevere, and withstand danger, fear, or difficulty. But Brené Brown reminds us that courage, the original definition of courage, when it first came into the English language, is from the Latin word cor, meaning heart. And the original definition was to tell the story of who you are with your whole heart. But for me, courage is not just about vulnerability, but for me, courage is also about vulnerability. And vulnerability is not winning or losing, according to Brené Brown. It's having the courage to show up when you can't control the outcome. Sorry, I'm just having difficulty with my slides.
Liza, we're actually not seeing your slides yet.
Oh, what? Okay.
So do you want Kate to share them for you?
I think she'll have to.
Okay. Okay, Kate, do you mind pulling those up for Liza?
So do I need to stop sharing my screen?
You actually aren't sharing your screen.
Oh, okay, hang on.
That's okay. You don't have to do anything. So Kate has them up now, and can you see that?
Hang on.
So we're in courage. I think next slide, Kate. Yeah.
Oh, we could take it from here if that works.
Great.
Sorry, guys.
No, thank you, Liza.
Okay, so Merriam-Webster defines courage as mental or moral strength to venture, persevere, and withstand danger, fear, or difficulty. Next. But Brené Brown, next slide. But Brené Brown reminds us that courage, the original definition, first came into the English language, comes from the Latin word cor, meaning heart. And the original definition was to tell the story of who you are with your whole heart. Next slide. Next slide. But for me, courage is also about vulnerability, and vulnerability is not winning or losing, according to Brené Brown, but it's having the courage to show up when you can't control the outcome. So when your calling is to serve, nothing gets in the way of creating a new identity and a new way of being, not even COVID. You learn to forge your own path. Faith, courage, prayer, and hope become your best friends. You listen with your heart and take action. So I created a little mini timeline of a few of the important events that occurred along our journey of daring greatly. So when the pandemic started making its way to the Northwest, we gave our staff grace to decide who wanted to self-isolate and those that were willing to continue on and stay. So those that stayed, we created these amazing weekly theme-based outreach packages. And we started with social emotional wellness. And so hence Teach My Preschooler was created. Community observations of the effects of children being kept indoors supported the creation of Playground by Appointment. Next. Sorry, next. So after about 10 weeks, rumblings of reopening fueled the development of a post-COVID orientation. So my manager and myself, we created a 3-week team building and mental health initiative for all of our team here at the Xanstiger Head Start. So today, our staff continue the holistic development and processes to support continued wellness and learning needed for our staff to provide quality care. And to date, we are currently the only site of 6 here within the Nisga'a Nation that has its doors open for early learning services. But more excitingly, partnerships and opportunities are starting to regrow. Next slide. So with the onset of COVID-19 and the direction to close our doors to the public, our team found an innovative way to stay connected and continue the education of our preschoolers ages 3, 4, and 5 and their families. So each child was actually hand delivered one of these beautiful bags that was chock full of resources every Monday. And so the parents alongside the children were able to learn together, have fun together with all of the activities, the information and the books that went into each of the bags. And in total 10 weeks, a total of 230 learning resource kits were distributed. Next slide. Sorry, next slide. Here's my coworker, Levita Tate, and she is putting together these wonderful marshmallow Play-Doh kits that went into the mindfulness bags. Next slide. So here's actually an example of one of our kits. This is the mindfulness kit. And as you can see here, we have 2 laminated mindfulness stories that went into the bags. This one was all about clouds, so we included like some marshmallow Play-Doh. This one was all about bubbles, so we included some bubbles. As you can see, we have 2 books here, IMPs, meditation. Each kit had these cheat sheets that I created, and with each cheat sheet was sort of like a what is it, why is it important to children, and how do parents do this with their kids? How do you support their learning at home? We also included this mindfulness eating exercise. Most of you are probably familiar with the raisin exercise, and then we have these 4 activity cards that went to bags, and children could choose one daily and have fun with their family. But my most favorite part of this bag was the treasure chest worry activity. And so in this little chest had these beautiful little gems, and the child was able to whisper their worry into it, place it into the chest, and then have the parents hold it for safekeeping. So as you can see to the left here, our list of the 10 weeks that we did. So with the social and emotional package, we included a little COVID family-friendly information. We created a wellness wheel to really support health initiatives at home. And then there was an online story that maybe some of you had seen, just up for kids about what is COVID, how to stay safe, etc. So as you can see in week 2, during the physical activity, we did launch Playground by Appointment, free art, celebrating mothers, planting, fatherhood, literacy, mindfulness, nutrition, math, and science. Next slide. Sorry, next slide. Sorry, guys, can we get the next slide?
Liza, I think that it's just a little delayed on your end. So the slide is coming up, but it's just harder for you to see it because I think you're on a bit of a delay.
Oh, okay. Sorry, guys.
That's
all right.
Okay.
Oh, you're how many slides over now?
We're now looking at a few words from parents. So Kate, if you could go back one. And Liza, you're a little bit crackly, so I think the less you move, the better the sound is. But it's
okay. So maybe if I just stop my video, that might help.
It's perfect right now.
Okay. So if you can just go back, there's actually a few photos.
Yeah, they're up right now.
Okay. So I'm not sure which photo is up.
It's the last one, but we can go back a little bit.
Yeah, just a couple. It's be really nice to highlight the parents' pieces. So this is actually one of my favorite photos. This is a chocolate finger painting, pudding, and eating apparently. And we always made sure that we included enough in the kits for siblings. Next photo. So in the next photo, I do believe is the one, yes, Theo with his chia pet there and for the planting. And in the next photo, we can see Gigi there with her grandchildren. You can really just see the engagement between them. If that photo's up, the next photo. Yes, that one. Okay, and next.
Liza, yeah, you're right. It might be better if you turn off your video just for bandwidth. Although we do love seeing you. And now we're looking at the few words from parents' side.
Right. Okay. Sorry, guys. All right. So weekly short surveys were distributed along with the materials. The surveys really supported our work in creating the weekly learning resource kits. We got to hear from parents like what was working, what they wanted to see more of. In addition, those parents that returned surveys were entered into weekly incentive draws. So families won like pizza parties, yogurt parfait making, family board games, grocery gift cards, movie nights with DVD and popcorn. And so here are a few words from the parents from the surveys. So one of the initial questions that we asked is, one thing I learned and will try, and we asked them to finish the sentence. And so what we heard was singing more, to let my child be creative and think creatively with them, exercising with children and how often, to let my child lead the activity, to have fun, to not be afraid to get messy, to take learning outside, to get ideas flowing. I'm going to do more plants. He loved it. The alphabet hunt is a cool tool to learn the ABCs, mindful eating, and incorporating more veggies into breakfast and lunch. So interestingly enough, like after 10 years of delivering center-based parental parenting programs, like literally years of trying to instill key early learning values into parents, I mean, these comments just really demonstrated that in learning alongside their children, all of the values that we hold as educators were becoming embedded as they had fun together and as they learned with the packages together. So that was really exciting and something that we couldn't have predicted. So just moving on, more of the survey results. So if you just want to click there, yes. We asked, did you and your family have fun with the resources? And 94% said excellent. Were the resources helpful and easy to understand? 96% said excellent. Will the information you received this week be useful to you and your family? And 99% said excellent. So as you can see, the bags were well received. I just wanted to include, if you just click again, a few of the books that we carefully chose. As you can see, I Am Love, Mama Do You Love Me, The Bucket Filling, Runaway Bunny, Counting Kisses, I Am Peace. What we really wanted to instill at home was this sense of empathy and connection amongst the children and their siblings and the parents. So next slide. So along with Teach My Preschooler, we created Playground by Appointment. So what we were hearing in community rumblings were that parents were really frustrated, and it was showing up in social media streams. There was lots of lateral violence, and we were hearing that some of our homes were becoming unsafe for children. And so if you just click next slide, we launched this innovative Playground by Appointment. And so what it meant was that families could book our park for 30 minutes at a time. And so in between families, we'd run around. Yes, we would run around and wipe everything, hand sanitize everything down for the next family. So we did provide gloves and hand sanitizer to and from the park. And if you can just see the look on these families' faces, just the sheer joy of getting outdoors and being outside with their families. But as it was mentioned by previous presenters, that as we were realizing that the adults were needing a lot more support, we also started teaching an outdoor fitness class, a social distancing fitness class that was hosted for all community members, including our families. So everybody was welcome. And we did that throughout the summer. This is one of my favorite photos. This here is a grandfather and his granddaughter enjoying the park together. Next slide. All right. Yeah, just look at those faces. So then after about 10, 12 weeks, as mentioned, came the question of, do we open? And, so as educators, of course, we started to ask ourselves the critical questions. Well, first of all, can we open? Next slide. What was happening in other parts of the nation, what was happening in our region. We also asked ourselves, what do we have to consider before opening? What are the things that need to be done? Next. How will our community respond? What will the response be? Will parents be wanting to send their children? Will they? How would our community answer to us, and how could we answer to them? And then next, what are our challenges? What were the challenges that we were going to experience moving forward? And then just what supports do we need to open? What do we need to ensure that we're doing to be safe? But it wasn't until we asked the most critical question of ourselves, and that is why? Why do we need to open? And just click next. And as we heard from all the presenters before us, the many, many reasons of, yes, we do need to open. So as adults, we were seeing stress and fatigue and frustration and anxiety. We were seeing fear and our post-trauma stress being triggered, depression, mental health issues. And so we knew that by prolonging opening, that this was just going to carry on and become compounded amongst not just our adults, but the children and what they would be experiencing at the hands of the adults who were struggling. So yes, we decided to open. So once we decided to open, we knew that it was not going to be as simple as just opening our doors to staff. Yep, okay, we're open, everybody back. So I just really wanted to share a few of the strategies that really supported our ability to move forward in a positive way. And I just love this quote here by Amit Ray, which is, "The greatest compassion is the prevention of human suffering through patience, alertness, courage, and kindness." And this quote really encompassed the 3 weeks of work that we did together as a team. And so one of the most important things that had a huge impact were these pre and post interviews that my manager and myself created, that we did prior to the orientation and then 3 weeks later after. We really wanted to hear about our staff's COVID experiences, what they learned, what kind of supports they were going to need moving forward, coming back to work, and what they would do different if there was another wave. And so what we could predict, obviously, pre-orientation, as again suggested by the presenters, that our team was really going to be coming back from self-isolation with sort of these disempowering events that were occurring in their homes and within their larger family systems. So we were seeing addictions and mental health issues, stress, physical health issues, etc. But what we couldn't predict by doing this, by really focusing on our team's wellness, was that the outcomes that we would experience and that we continue to this day benefit from by prioritizing them. Another really key area was the intervention plans. Obviously, with opening, we had to create a whole new series of policies and procedures. And to ensure continuity and understanding, nobody was left behind. We all worked on them together, so everybody understood what was expected of us and what we could expect of our families. Next slide. So, in the 3 weeks, our focus was wellness. And so that was our whole theme, how we take care of ourselves and others. And so every group does have guidelines, but I just kind of wanted to highlight a few that really made a difference for us, and really talking about really sensitive areas of our lives. And so we talked about being present and paying attention and being mindful and open and honesty. We put those phones away and we really dedicated our time to each other, and we had fun and to have a good sense of humor as we worked together. So here's my team here. Next slide. We have Wanda Stevens right here. She's the manager. Lavita Tate, and everybody has a Lavita Tate in their organization. She's the one that, she does the janitorial stuff, she does the cooking, she works on the floor, she knows where everything is in the center. She's just a godsend. So I'm sure everybody has one of those. Amanda Collison, she also works in the preschool. Chantel Stevens in the daycare. Dora Watts and Charmaine Calder. So that's my team. And I could go on, but that would take up our time. And I realized that my time is been taken up quite a bit with all of the technical issues, so I'm just going to keep moving forward. Next slide. So as we prioritized our health of our team, we started talking about how we upkeep our health. And so we had all these fun health challenge ideas that we still do here at the center monthly, and we did them through the 3 weeks. And we also came up with some fun incentives to keep everybody on board. And so next slide. You can see here my teammate Chantel Stevens, who won the water challenge, and I can tell you that week that the bathroom was my best friend that week. Yeah, but she drank 9 liters and she won herself a little gift card. Next slide. So here also is a really important, I wanted to show this because if you can imagine, everybody being in their own little bubble, even those that agreed to stay at work, we had to social distance, we had to kind of stay in our offices. It was a whole different way of being. And so all of a sudden we were pulling us all together in one space, having to share a space. And so just being each other's bubble was an undertaking. And so this was a really fun team building exercise where my coworker here, she had to be blindfolded and make her way through this sort of maze of cups filled with water, and only could move with the sound of our voices. And so everybody had to take a turn, and it was sure an exercise of trust and vulnerability and just really bringing us together. So next slide. So, but of course it wasn't all about fun and games. We realized that our team was going to have to unpack COVID and its effects, but also self-reflect on what we needed, and the families coming in and that we would deal with. You know, we're going to need empathy, and they were going to need understanding and good, solid ways of communicating. And so we undertook Dr. Marshall Rosenberg's nonviolent communication in those 3 weeks. And so what a learning curve for each and every one of us. Next. And then we also had to consider the children and what were going to be coming through our doors. If we weren't sure what we were going to expect, if we were going to have a lot of dysregulation, if we were going to have children with some behavioral issues. And so we really wanted to upgrade our toolbox, so to say. And so we went through the whole brainchild and the 12 strategies. And as we also cleaned up our guidance and intervention policies, because we realized that you know, we weren't sure what we were going to expect. So what we learned, like any other traumatic event, our team needed to debrief, reflect, and process their COVID-19 experience in a safe, supportive environment. By practicing empathy and gaining the tools to support one's ability to know how they feel, what we needed, and how to make requests of one another, it has changed our lives forever, as not only just educators and caregivers, but as human beings. And we learned how to dare greatly and take action in the face of fear. So one of the things that I just have to say about my team to date, because of the pieces and the tools that we've integrated around the mental health initiative, is that my team comes in prepared and ready to be at a 10. And if they're not at a 10, what they need in order to get to a 10. And if they can't become a 10, then the grace of understanding that, okay, you know, this may be a day that they need to be at home, because we recognize that every child coming through deserves to have a caregiver at a 10. And we try to make that happen. So if our team is counseling, we do pay that, their hourly counseling, for them to take that time for themselves. So I just want to wrap up you with this quote here by Nelson Mandela, which just really demonstrates and embraces what we're doing here at the Extend-Seeker Head Start. And it is, our human compassion binds us the one to the other, not in pity or patronizingly, but as human beings who have learned how to turn our common suffering into hope for the future. So I just want to really say how honored and grateful I am to share our experience here at the Extend-Seeker Head Start in Lacazette. But I just also want to honor, because I know that there are many other organizations, many other communities and centers that have dared greatly and have been courageous and created initiatives within their own realities to ensure the safety and well-being and the continued thriving of their own. So thank you very much. I appreciate your time.
Thanks, Liza. I think it's courageous to do a presentation to 300 people from a remote corner of British Columbia. So thanks so much. I'm going to turn it right over to Paul for the dialogue.
Hello, team. I'm just sharing my screen one more time. Thank you to Liza and Alisa. And we're bringing back Hasina from the first half of our presentation today. And so welcome to the second and wrap-up dialogue for our HELP Expo this morning. And I'm so excited to be engaging Liza and Alisa and Hasina in the conversation. Before doing so, I wanted to honor, though, the voices of the many hundreds of people who remain on the call today, because they not only shared some of the anxieties they had about the legacy that COVID may leave with us, but as I ended the last dialogue with, they also had a chance to share some hopes. And let me just feature some of those words that are coming from the audience members, and then I'll turn the conversation back to our panelists. So some of you out there talked about feeling hopeful that families now are closer in many respects as a result of COVID, and that will remain so, and that communities maybe remain stronger, and that we have the chance now to address the inequities highlighted by the pandemic, which touched us back on some of the comments from Rihanna and Jennifer and others in the previous dialogue. A renewed focus on mental health and well-being and increased mental health services, that's what we're hopeful for. Prioritizing more generally the needs of families with children. Keeping the positive opportunities provided by technology and addressing the challenges that come from being in remote and rural areas. And I want to end with a couple of very specific quotes because I really thought that they captured the tone and tenor of all the work that we're trying to do at HELP and what we're doing in our family serving communities practice more generally. So here's a line from one of you out there in the Zoom land. My hope is that some good will come from the pandemic, even if we cannot see the benefits right now. For example, new perspectives and reevaluation of priorities within families, like time spent with children, work-life benefit, and larger communities, meaning more investments in childcare and education. And someone who could definitely be working in the inner hallways of HELP will implement system-wide changes that address root causes of mental health challenges and the social determinants of health. That pretty much captures the HELP mission in many ways. But now let's turn it back from your voices back to our panelists. I'm going to stop sharing the screen so I can see our lovely panelists' faces. I've got Hasina there, Alisa, and I'm assuming I still have Liza. Do I have you, Liza? On Zoom, that is?
Yes.
Wonderful.
My video kind of messes everybody up, so we'll leave it off.
Perfect. I just wanted to make sure I had your voice there. It's not showing for me. So I'd like to just open the conversation with a shared question to all three of you. You saw that I featured people's hopes, and I ended the last dialogue with a question to the panelists about hope. So I'm going to do that with you as well. But I wanted to create a space again for you to highlight for us what are some of the worries that you have about the lasting legacy of the pandemic in a negative way that we're going to have to be mindful of as we aim to build back better. And Hasina, since you've been on hold for a while, I'm going to start with you, then Liza, and then we'll end with Alisa.
Thanks, Paul. Thanks for the opportunity to comment. And I'm still buzzing with inspiration from Liza's incredible presentation. Despite the technical difficulties, it all came through, Liza. But in terms of long-lasting impacts, well, I think we're just beginning to understand what they are. As Jennifer has noted, there has been work to look at other pandemic and emergency settings to better understand what could be the potential impacts. And of course, 1 year in, we're learning about the long-term impacts already. 1 year is a long time, but we'll continue to learn about these impacts as time goes on. And I think, as has been noted by many of the panelists and audience members, the main worry for me is the disproportionate impacts. And first of all, learning what they are, which groups are most affected, and then thinking about how we can come up with creative solutions, as Liza has done with her team, and from a systems perspective of how we can actually start addressing some of these challenges, some of which we already know, we can anticipate, and others that are becoming clearer over time. So I think that's the long-term worry, that we don't just go back to normal. And yes, there's renewed optimism with the vaccine situation, et cetera. But for some groups, that resilience is not going to be there. And I think what we really need to ensure is that we identify those groups and that we proactively find services and make sure that they're supported, rather than asking them to fend for themselves and advocate for themselves. So that would be my and long-term concern.
I'll come back to some of that in a bit. Liza.
Well, when I think about our communities that are already sort of lagging behind in resources and what's happening in the school level systems, like where we rate in the province, for me, it's sort of seeing that exasperated, like even more so, the gaps getting bigger, and also the impacts that we were seeing starting younger, right? So, I mean, sadly in our Indigenous community, we do see mental health issues, like COVID or no COVID, we do see a lot of, sadly, the disempowering things that happen to our youth, around suicide, addictions, those pieces. And I guess for me, that fear is it's starting to occur at younger ages and just being more exasperated. And then in areas where there's not a lot of resources to support. And then the other piece for me is just that virtual connection, because, throughout residential school experiences in the colonized times of our people, there was so much disconnect and we are still suffering the years of that disconnect. And just we're on the cusp of understanding connection and human connection and the importance of love and touch and, all of those pieces, and forgiveness. And how we're being also forced to go back to this sort of disconnect, via virtual ways of being and knowing. And I just think that's going to have huge impacts or delays in our healing process.
the cusp of renewing connection, and then the pandemic disrupting that. That is that's not a phrase I'd expected you to use. And I'm going to really percolate about that over the rest of this dialogue and the rest of the month, years. But before I do, it's not my dialogue. I want to hand it over to Alisa.
Thanks, Paul. So in thinking about young children in particular, and thinking about some of what I highlighted with our results, certainly there's the concern about the lack of peer interaction, the lack of connection to others, where children can learn and build those social skills and be strong in that area when they arrive at K. And, you know, I'm not worried about the young ones in particular. Some of the work I do with children who've been abandoned to institutions and suffered severe psychosocial deprivation early on, we followed through many years, and I've watched them interact with their close friends when they're adolescents. And so that natural inclination, as Liza said, for us to be social beings, to connect socially, to make those connections, will prevail, and our young ones will develop those skills and seek others and form those friendships over time. I'm worried for the educators, though, that will be supporting them in that transition from being deprived of those experiences and then now having to come on board with suddenly being embedded in a peer group, being at school, if they haven't had a chance to build those schools leading up to it. So it's going to be our kindergarten teachers, our educators who are scaffolding these kids and filling the gap in what they missed out on during this pandemic period. And especially for those who our little ones who missed out on a whole year of those social experiences and that opportunity, our educators are going to have their hands full in helping to support them when they do arrive at school. And so hopefully, you know, as Magdalena obviously highlighted in her presentation, that will be a focus and a recognition that our educators are the ones we need to support, because they will be the ones bearing the brunt of this transition back once the pandemic is over.
Well, can we push on that a little bit further, given that you're anticipating that the educators of kindergarten grade 1, I guess early educators in the childcare system, they suddenly are going to face a new additional responsibility on top of already having to address sort of the time and the money squeeze facing many diverse kinds of families in our province. Now, on top of that, you know, an extra obligation to be addressing some of the disconnection that children have been suffering during the pandemic. So what do we as a society, what do we as a childcare system and a school system need to be investing and doing to support those educators as we're building back better and not going just simply back to normal?
Would you like me to answer?
Yes, that's to you. Well, and it could be to anybody, but I'm ripping off you.
You can't turn your head to look at us. Well, I think, you know, again, as Magdalena was highlighting, as our colleague, Dr. Kim Shona-Reichel has often highlighted, supporting the educators first so that they can support the children is a piece that has become more obvious and brought to the forefront in the education sector, and understanding that if educators are going to do a good job of teaching our young ones and you know, teaching them about all sorts of things and supporting them, they need to feel supported, connected, and recognizing that this is a pandemic that they've lived through too, that they're not just supporting children who live through it, but they themselves have potentially suffered trauma or all sorts of challenges, and you know, having our expectations be reflective of our acknowledgement and our empathy for those who are working through and will continue to work during the pandemic and have to support our most precious young ones as we return to normal.
Okay, I guess we're gonna have to.
Would I be able to?
Yeah, please do.
Sorry,
Liza.
would I be able to chime? Yeah, would I be able to chime in on that one?
Yeah, by all means.
One of the things that I didn't mention in my presentation was like one of the things, the big, huge shifts that we saw by focusing on the educators, like on our team, like the adults, was, you know, what they learned really just did translate in the work that they did with the kids. Like all of a sudden, like there was just way more empathy and flexibility and love in the room that there had been, that you would never learn from a workshop, right? Or we tried for years to sort of instill these values, but we actually really weren't able to see them transpire until it started with us as individuals and learning those tools, going through the process. Like it's not a two-dimensional process. It's like a four-dimensional learning curve. And so, with COVID for us, like that reset that it provided for us was to really be able to focus on those values of love and empathy and understanding and grace and forgiveness. And so I don't know if that would have happened if COVID didn't actually happen.
Well, that's a hopeful statement to make. Hasina, Liza and Alisa are just talking about how a lot of the responsibilities falling onto educators. The data that you shared at the beginning of your presentation today struck me by showing not only interesting age trends in anxiety and disproportionate amounts of anxiety amongst a younger part of our population, but then especially concentrated in parents with kids. And then of course there's the gender dynamic there in terms of the impact of the pandemic and the she session on diverse groups of women in society. So I'm hoping can you share more of your thinking about what we need to do as a society to specifically address and reduce that disproportionate burden that the pandemic has imposed upon parents with kids, women with kids? What are we going to need to do as we build back better?
Great question. Thanks. I mean, I think the first thing we need to do is acknowledge that there has been disproportionate impacts, right? I think a lot of parents probably, and I'm a parent of 2 toddlers myself, and I think a lot of parents have felt like they've just been expected to carry on as normal. And really there's nothing about this that has been normal for us, for our kids. And so I think the first step really is to acknowledge to parents, to educators, all those groups that are kind of grappling with these, increased demands. First of all, this isn't normal. We hear you, we see you, and we want to find a way to reduce the impacts and mitigate the impacts. And also, I think the next step then is to creatively think about solutions. And I wish I had the answers from a personal and professional perspective. I'm being really inspired, as I noted, by some of the conversations in this session. But what I really like is Liza's emphasis on being proactive. So she said, well, we're going to have to think about people coming back and how are we going to prepare for that? And this, and then set out some ways to do that. And for parents, what can we do for parents? I think, again, assuming that everyone is just going to be able to pick up where they left off without breaks, without some sort of acknowledgement that things have been so tough for such a long period of time, is going to lead to more challenges long term. And so it really just works to our benefit societally and as human beings to acknowledge that the challenges have been difficult this year and work, I think, from an intersectoral perspective to work collaboratively to think about solutions and better supports now and in the future.
Well, maybe as we're coming toward the end of our time today and we're thinking about some of the challenges, there has been a hopeful theme throughout the comments that you've been making and that the other presenters have been making today. And Alisa, I'm going to come to you, and then I might just, I think, probably then turn the question also over to Liza. But Alisa, one of your themes has been, hey, there's been more time to play, more time to read together. And there's, I think the language you've used in previous conversations with me, there's been under-scheduling. And that you view the under-scheduling to actually be a positive and something we might want to retain and see persist post-pandemic. Why do you think under-scheduling is important, and what are we going to do to try and see it persist over time?
Thanks, Paul. Yeah, that's it's been such a almost encouraging or kind of great unintended consequence, positive unintended consequence of this pandemic. When we thought it was just going to be a few months, everything was just very novel. The changes were dramatic and everybody thought, oh, well, things will go back to normal quickly. Now we will have had a year or, maybe a year and a half for families, for children to settle into a different day-to-day life that necessarily involves fewer activities, commitments, organized activities, whether it be extracurricular activities in general. And of course, in no way am I dismissing the importance and the value of those extracurricular activities in children's lives, especially for children who benefit from those connections outside the home. But on the flip side, we do know that many families and many children were suffering from burnout, from being overscheduled, from having too many responsibilities and too many obligations at such a young age. And to settle into that space of quiet, of simple time at home, and realizing that, or giving families the opportunity to see, oh wow, without all of those things, our child is still happy and healthy and thriving, and so are we, and we're maybe even less stressed and less stretched to desperately provide all those opportunities for our children that are important, but equally important is that time together at home, that time for quiet, that time for a break. And so I'm hoping that this period of pandemic will be a reset for some families where they see where they had no choice but to see a different type of daily life and schedule for their children that may be more beneficial for their children and their families.
Mm. And Liza, maybe if we could riff off of Alisa's observations about underscheduling in about 60 seconds, which I know is a tall order. How do you see the relationship between underscheduling and your earlier comments about being on the cusp of renewing connection, and then the pandemic to some degree distorted that, impeded that? Do you see any relationship between underscheduling and having time to renew connection?
I think underscheduling in some ways took a lot of pressures off of a lot of the community, and this sort of sense of feeling like they have to catch up, right? Like, because our communities struggle, they struggled with the mainstream because of the lack of resources. And so there's a constant kind of feeling of like having to catch up. And so the first time it's like, okay, you know what, like catching up is not even the issue. We need to figure out like how we do this in a way that supports where we're at. And so it's an acceptance of where we're at. And now what are we going to do about it? But it also is forcing this sort of shift from trying to catch up to mainstream to wellness, which is really interesting. So we've got these wellness, like the priority of wellness popping up. Like we have all these new wellness coordinators, all these new wellness initiatives, wellness Zoom meetings that weren't happening pre-pandemic. So.
And Hasina, as our time draws to a close, I'm going to give you the last word on the day, and I'm going to invite you to leave us with a sense of what makes you hopeful going forward.
Thank you. And thank you again to everyone. It's been such an incredible session. I would say from a sort of broader perspective, what makes me hopeful is thinking about how we see our world now, and how, for better or worse, we're all connected, right? We can see that with pathogens that really are, don't see any borders. And similarly, I think if we consider the longer term recovery, if people are vaccinated in, one part of the world, but not the other, there's going to be a rise in variants, and we'll all be kind of not back to square one, but certainly stepping back. So I'm hoping that some of our perspective can change to acknowledge that we live in a globalized world, that we're one humanity. And back to your point about climate change, Paul, I hope that this perspective can extend beyond infectious disease to encompass some of the other global problems facing us as a global community. And my hope is that we, our changed perspective allows us to embrace everyone and those problems in that way.
Well, may your hope come to be. And I think that's a really lovely note to end our dialogue on. And I'm going to hand it back over to Joanne to wrap us up and make sure we launch everyone onto the rest of their day on time. Thanks so much to the panelists.
Thank you all. Thanks, Paul. We made it 2 minutes to spare. If you have questions that you didn't have a chance to ask, please don't hesitate to email us, earlylearning@ubc.ca, that you see there, and we will get the answer for you. This is the first time we've tried this online version of things this year. You will receive a survey from us. It's really important that you take a few minutes to let us know what worked and what didn't work for you. We are looking for new members of our Aboriginal Steering Committee, an opportunity to join Liza, Rihanna, and a many other wonderful people who are working to support our work at HELP. If you're interested, please email Kinwa. You see her information down there below. Stay tuned. We have some upcoming expo events. Next one, 27th of April with Dr. Mike Kobor and Joelle Lamoule. And then May 10th, one with Ava Oberle, Mariana Bersoni, and Megan Zini about promoting outdoor play. So get on our newsletter, check it out on our website in terms of those two and other ones that will be coming up. Finally, thank you. Thank you to our amazing presenters. What an incredible morning. Thank you to the HELP team, everybody behind the scenes there. Great work, guys. And special thank you to all of you who took the time to participate for us, with us today. The two words that are going to continue to buzz in my brain for the rest of the day are courage and common voice. Those two ideas, I think with courage and with some common voice, we can progress against these challenges that we're facing. So see you here the next time we convene. Thanks again, everybody.